on your rider.
Gets her out of the house.
Sometimes I need help in my car.
Good afternoon. Pictures. Good afternoon, everyone. Welcome to the Board of Trustees meeting here at the Indian River County building of the Indian River County Hospital District. We could please rise for pledge allegiance. I
Pledge allegiance to the flag of the United States of America, to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Before we move on to our organizational matters, I wondered if Frank, you might give a brief invocation.
Happy to, Mr. Chair. Thank you. If we could all bow our heads. As we gather at the start of this new year, we pause to reflect with gratitude for the trust placed in us, for the colleagues beside us, and the opportunity to serve our community. May this year bring us clarity of purpose, wisdom in our decisions, and the courage to do what is right even when it is not easy. Help us to remain focused on all those who depend on our work, mindful that behind every policy, every budget line, and every vote are real lives and real needs. As we look ahead, may we be guided by integrity, compassion, collaboration, and a shared commitment to progress, building on what has been accomplished and remaining open to new ideas that strengthen the health and well-being of all those we serve. With humility and resolve, we ask for steady hands and open minds as we begin this year together. Amen.
Amen. Well, that was very nice. Thank you very much, Frank. I'd like to call the annual meeting of the Board of Trustees to order. As required by our governing legislation, bylaws, and Robert's Rules of Orders, we will now conduct the annual election of officers for the positions of chair, vice chair, secretary, assistant secretary, and treasurer. At this time, I'd like to turn over the election process to our parliamentarian.
Thank you, Mr. Chair. Before we begin, I want to state for the record that as a public special taxing district, all actions of this board, including the election of officers, must be conducted in full compliance with the Florida Sunshine Law. This means all deliberations, nominations, and voting must occur openly and publicly. The officer elections cannot be conducted secretly, and no portion of the process may be hidden from public view. Although we use written officer voting sheets for administrative accuracy, these ballots are not secret ballots. Each trustee's vote will be read aloud into the record and preserved as part of the district's official public records. We will now proceed with the annual election of officers. Each office will be taken up individually in the following order: chair, vice chair, secretary, assistant secretary, and treasurer. Elections will be conducted using the district officer voting sheets, which is consistent with the board's bylaws, Robert's Rules of Order, the requirements of Florida law, which has been approved as to form in a prior meeting by all trustees. Before we begin nominations, I'll read the instructions for completing the officer voting sheets. When nominations are opened, you're going to print the name of each nominated and accepted candidate on your voting sheet. When the chair officially calls for a vote, I'm the chair in this instance as your parliamentarian, you're going to mark an X next to the name of the candidate you wish to elect. You may vote for only one candidate per officer position. The trustee certification section at the bottom of your voting sheet must be completed in full, or the vote will be considered void. So we'll complete that. You'll sign, you'll print your name, you'll date it. After marking your vote, pass your completed voting sheet to the parliamentarian, that's me. I will then read each vote into the record for tallying and conclusion in the minutes. If there is a tie, an immediate runoff election will be conducted using the same procedure. And of course, all voting sheets will be retained as part of the official record of the district in accordance with applicable law and procedures. We will now begin with the office of chair. The floor is now open for nominations for the office of chair.
Well, I would nominate Bill Cooney to return as president.
Mr. Cooney, do you accept the nomination for chair?
I accept the nomination.
Okay. Are there any further nominations?
Madam Chair, I'd like to nominate Carrie Harris for chair.
Gary.
Gary Bartlett.
Lord,
Time slipped,
I married.
time slipped.
I've been divorced a while.
Ms. Bartlett, do you accept the nomination for chair?
Do, thank you.
Are there any further nominations for chair? Hearing none, I'll declare the nominations closed. Trustees, please print the names of the nominated candidates on your voting sheet, that being Dr. Bill Cooney and Ms. Carrie Bartlett. Once you've printed the names, you may cast your vote for chair by marking an X next to your chosen candidate. And then you're going to sign the trustee certification. You'll print your name, then you'll sign it and you'll date it. And you'll pass your votes towards me so that I can review and read them into the record. However you want to do it. I'm going to read it in anyways. And then we have one trustee who is on Zoom. And he's going to be able to vote as well. He's been provided with these sheets and he will put his up to the camera so we can see who he voted for. And then it will be returned to the office to put with the original records as well. We're going to handle these first.
And Jennifer, I've already scanned and emailed it to Frank and Kate, but I'll hold it up for the camera as well.
Okay. Yeah, we need to have you do that.
Okay, we're ready for him to hold his up.
Okay, Paul, could you go ahead and hold it up?
Is it too much? Let me see.
Okay, a little bit to the right. There we go. I can see that you put both William Cooney and Carrie Bartlett on the ballot. Can you just
There's
slide it
my
to the right one more? You signed it, you printed your name, you dated it, and you voted for William Cooney. So for the record, Paul Westcott voted for William Cooney for the office of chair.
Here's the, and you can read them out.
Okay, so Carrie Bartlett voted for Carrie Bartlett. Michael Kent voted for Carrie Bartlett. Alan Jones voted for Bill Cooney. Chuck Mackett voted for Carrie Bartlett. Bill Cooney voted for Bill Cooney. Aaron Deagle voted for Carrie Bartlett. What does that tally give us? Carrie Bartlett is going to be our new chair with 4 votes in favor.
congratulations, Carrie.
Okay, so we'll complete the elections before we turn the office or roll over to Ms. Bartlett to lead the meeting. So she's going to be the new chair. All right, so now we're going to go ahead and proceed with the election of vice chair. The floor is open for nominations for the office of vice chair.
I would like to nominate Alan Jones.
Okay, Mr. Jones, do you accept the nomination?
I'd be honored.
Are there any further nominations?
Yes, I'd like to nominate Chuck Mackett, please.
Okay, Dr. Mackett, do you accept the nomination?
Yes.
Are there any further nominations for the role of vice chair? Hearing none, I'll declare the nominations closed for vice chair. And you can proceed to vote just like we did for chair. Make sure both candidates' names are listed on your ballot and you're going to put an X next to the person you're voting for. You're going to print and sign your name and date it and pass it down to me. We're going to go through the same exercise with Paul that we just did. Okay, do I have them all?
Plus Paul.
One. Am I missing anybody?
Michael, you still working on yours?
Okay, Paul, you want to go ahead and put yours up?
I was.
Okay, when you're ready.
I've got it. I don't know if you can.
I can see it. I can see that you signed it, dated it, printed your name. You can't see the top. I need you to slide it the other way. Just so it's
Yeah.
better for them. Other way, opposite of whatever you're doing. There we go. I can see that you voted for Alan Jones for vice chair. So Paul Westcott voted for Alan Jones for vice chair. And I'll go ahead and read the other ones in. Michael Kint voted for Chuck Mackett. Bill Cooney voted for Alan Jones. Carrie Bartlett voted for Chuck Mackett. Chuck Mackett voted for Chuck Mackett. Alan Jones voted for Alan Jones. Aaron Deagle voted for Alan Jones. So our new vice chair is Alan Jones. Congratulations. Okay, we're going to go on to the election for secretary. Can I have nominations for the role of secretary?
I'd like to nominate Karen Deagle.
Do you accept the nomination?
Yeah.
Okay, thank you. Are there any further nominations for secretary? Hearing none, I'll declare the nominations closed. You still need to print the name on the ballot and put the X, even though there's only one candidate, because we have to have it for the record. Okay. Unanimous. It's one way to get it. All right. Thanks for having them all. See one? We have 6. I know it's not contested, but still. Okay, Paul, you can go ahead and put yours up.
Sure. Can you,
Now I can see it. Yes, I can see you voted for Karen Deagle for secretary, and just raise it up so I can see that you signed it. Okay, great. Printed, signed, dated. Perfect.
Ken, as we go through each of these, I'm emailing them. I've got a scan.
Okay, that works.
And I'm sending them to Frank and Kate.
Got it. Thank you, Paul.
Okay, so we had Paul voted for Karen Deagle, Michael voted for Karen Deagle, William Cooney voted for Karen Deagle, Chuck Mackett voted for Karen Deagle, Alan Jones voted for Karen Deagle, Carrie Bartlett voted for Karen Deagle, and Karen voted for Karen Deagle. So it is unanimous, 7-0 for secretary. All right, next is the election for our assistant secretary. You'll have nominations for assistant secretary. Yes, Dr. Mackett. Dr. Mackett, I was looking at him first.
I currently serve in that role and I will nominate myself because I don't think there's anyone left.
So you've self-nominated, which is allowed, and you are accepting that nomination.
Yes.
Okay. And Carrie, did you want to nominate a different person? Okay. Are there any other nominations for assistant secretary? Hearing none, we'll declare the
Dr. Mack-
nomination.
Dr. Mackett, just for the record, I am out here, but I am not interested. I'm perfectly happy serving the role I've been. So.
Okay. So hearing no further nominations, go ahead and fill out the ballot with the single nominee of Dr. Chuck Mackett, and we'll pass them down and just read them into the record.
And
Okay. Paul, do you want to go ahead and just hold yours up again?
yeah, second. Just trying to. There's
Okay, I see that
signature.
it's signed, printed and dated, and that you voted for Chuck Mackett for assistant
He's got a-
secretary. Put the
haven't-
X
no.
next to it for me.
There, now the X is there.
Okay, perfect.
Good.
Good. All right, I'll read the other ballots in. Michael Kent voted for Chuck Mackett for assistant secretary. Alan Jones also voted for Chuck Mackett. Chuck Mackett voted for Chuck Mackett. Carrie Bartlett voted for Chuck Mackett. William Cooney voted for Chuck Mackett, and Karen Deagle voted for Chuck Mackett. It is unanimous. You are the Assistant Secretary.
Other unanimous alone.
Okay, and then the last office that we need to fill is for our treasurer. Are there any nominations for the role of treasurer? Yes.
I nominate Michael Kent.
Okay. Mr. Kent, do you accept the nomination for treasurer?
Yes, ma'am.
Okay. Are there any further nominations for treasurer? Hearing none, I'll declare the nominations closed. And again, you can go ahead and fill out your ballots with the single nominee of Michael Kent for the role of treasurer. Okay. Paul, you want to go ahead and hold your ballot up for the treasurer? Okay, we can see that you voted and put an X for Michael Kent and that you signed, dated, and printed. Thank you. And I'll read the others into the record. Michael Kent voted for Michael Kent. Dr. Cooney voted for Michael Kent. Alan Jones for Michael Kent for the role of treasurer. Chuck Mackett voted for Michael Kent. Carrie Bartlett voted for Michael Kent, and Karen Deagle voted for Michael Kent. It is unanimous. This concludes the election of officers. The officers for the coming year are Ms. Carrie Bartlett as our board chair, Mr. Alan Jones as our board vice chair, Ms. Karen Deagle as our secretary, Dr. Chuck Mackett as our assistant secretary, and Mr. Michael Kent as our treasurer. Madam Chair, I return the meeting to you. However, I do have one more item on my list up here under organizational considerations, which is the frequency of meetings, the time and day of the meetings, and our meeting locations that we need to decide on. Yes, Mr. Kent.
Yeah, is mine on? I'm not even paying attention. I'm the one who's been talking about this. Thought about it from yesterday. The reality is all of us have kind of tuned in. Our calendars are set, at least for the next while. Let me put it that way. I won't say year. If we're really serious about making changes, and I think that there's legitimate discussion that can be had, we could take a little bit of time to do that and make a change 6 months from now or plan on it for the following year. I think there's a lot of reasons not to disrupt it. I've made my point. I don't want it to die. We'll discuss it heartily, I'm sure, somewhere down the pike.
Could we maybe include it in our strategic plan session that we have?
That would work for me.
Yes, Dr. Mackett.
I agree with what trustee Kent just said. I would also point out that I believe the county is used to that cadence as well.
that's a
There
good point.
are only certain days that
Yes,
we can.
we have to book this
This
one.
meeting with the county building available.
That's
Very
right.
Good point.
Is that
Never even
correct,
thought
Dave?
about it.
It's a hurdle, yes.
I'd like to make a motion that until we decide otherwise, our meeting schedule remain as it is, which is our board meeting as it's labeled, be the third Thursday of the month. And what is currently labeled the chairman's meeting be the preceding Wednesday of that third Thursday.
Okay. And time, would you want to include in your motion that the times remain the same and the meeting locations remain the same?
And the times remain the same. The chairman's meeting be 10 a.m. and the board meeting be 4 p.m.
Is there a second? A motion and a second? Any discussion?
The only thing I'd throw out is, I think there are going to be 1 or 2 points because they're always, or we know going into, for example, a chairman's meeting, that we're going to be hard pressed to get everything done. And two, I think that as long as it's noticed appropriately, those meeting times are brought down. Maybe it's just another half hour. But I think we ought to keep that open so we don't get hung up and just not having enough time to conduct all the business we've got to conduct.
Karen Deagle, we had talked about starting at 9 a.m. for the chairman's meeting rather than 10. at one point. Is that something that we might want to consider at this point instead of 10 a.m., or 9 a.m.?
And go for 3 hours.
Well,
Up to 3 hours.
3 hours. So now because we've been chewing at 2 hours and beyond, but recently. And so if we started at 9, at least we know the morning's gone and it's not. I would recommend 9 a.m.
And I can be comfortable with that because I know that we'll have efficiently run meetings. We won't expand the time just to have.
Just because you want to talk?
Has a bunch of conversation.
Oh.
But there are some times when we do need more than 2 hours.
9 a.m. would work for me as well.
9 a.m. works for me.
You're gone.
Oh, well, it's 3 a.m. or 4 a.m. if I'm at Maui, so it doesn't matter.
What's the matter?
How do we, oh, yeah.
Just don't go to sleep, Alan.
Well, there's a motion on the floor.
Could we
Do we amend it?
amend it? Paul, could we amend your?
I'm welcome to an amendment that it reflect the chairman's meeting begin at 9 a.m. rather than the 10 a.m. that was stated.
That need a second.
Second, it's amended.
Oh,
This would begin in February.
Is there a second?
Yes.
Okay, any further discussion? All in favor?
Aye.
Any opposed? Motion carries. The meetings will be, sorry, guys, the same frequency. The fourth Thursday, the Wednesday preceding. Chairman's meetings will begin at 9 a.m. and the monthly meetings will begin at 4 p.m. Chairman's meetings will be at the district office. The monthly meetings will be here at the county chambers. Thank you.
Parliamentarian, I might. I'd like to say I've been a pleasure to be the chair of the board for this past year. It's a wonderful experience. I wish Ray Bartlett best of success. I said at the beginning, there's many talented people among the 7 of us, and so it's worthwhile sharing that leadership position.
The only thing, it's exactly what I wanted to say. Thank you for the service. You worked diligently.
You had to attend a lot more meetings than we did this past
Yeah.
year, and you managed the meetings very well, and I appreciate your service. So thank you.
Okay, so, thank you. Consent agenda. May I have a motion to approve the consent agenda, which is the approval of the chairman's meeting minutes dated December 17th, regular monthly meeting minutes dated December 18th, and a January disbursement of $1,947,841.07.
Move approval?
Is there a second?
Second.
All in favor?
aye.
Aye.
Thank you. Reports. Jennifer, do you have a voice?
I'm trying.
Okay.
I'm gonna see if Dana can read it in. She's on Zoom.
I'd just like to point out that it's nothing better than a lawyer that can't.
I've been fine, and then it just hits me.
I'll pass by and you can try it again later.
Okay, sounds good.
I am here if you need me, Jennifer.
Dana's gonna read it in. She has it.
Okay, thank you.
Okay, give me just 1 second. Okay. For the January council report, we do have several things to bring up that we have done since the December meeting. First, we have a reminder that our monthly meeting packets do contain a copy of Form 8B, which is the statutory memorandum of voting conflict. If a conflict does arise where a trustee needs to recuse him or herself, in accordance with the conflict of interest policy, you will always have the form on hand and available to fill out. The attorney's overview is also included with each monthly meeting packet. This overview contains a very good summary of our practices and procedures in conducting district public meetings and also sets out the parameters for public comment. All public comment shall be heard in accordance with the district's practices for calling for or receiving public comment. Third, we prepared for your review and approval a proposed lease amendment by and between the district and VCOM for the lease for the Human Services Building at the December board meeting, and mentioning that prepared lease was the one that we did present at the December meeting. So at that meeting, there was a 60-day extension that was granted to give parties time to refine that lease and then amend to fully reflect the parties' intentions moving forward. So that is an ongoing item that we are working on behalf of the district. In December, we met with the VNA and their council to review the VNA's request to connect the retention pond on the parcel owned by the district and leased to Cleveland Clinic. Currently, we are determining the next best step in this matter on behalf of the district and will be coordinating time to speak with Cleveland Clinic on this topic. We intend to bring this back before the board in February for further review. In the past month, we have worked to prepare for your annual elections that just took place. This was our first year holding the election as a ballot vote in accordance with the Florida Sunshine Laws and the board's newly adopted bylaws. We have reviewed the funding agreement template utilized by the district to memorialize agreement between the district and its funded agencies for funding terms. Proposed revisions to this template will be brought forth for adoption for the 2026-2027 funding cycle. We are continuing to work with district staff and the board on the 10th Street property matter and will provide support as is requested on this matter moving forward. Thank you.
Thank you. Any questions? Hearing none, we'll move on with the financial statement review. Michael Kent.
We've just completed the first quarter of Hospital District's 25-26 fiscal year. I'm happy and pleased to report the district's financial position continues to remain strong. To review the December financials as usual, please turn to the last 4 pages of the financial section of your board packet. And 4 pages from the end, you will find the landscape 1-page investment and cash snapshot. At the top of the page, you'll see that at December 31st, the district had received $19,139,124 of ad valorem taxes, which represents 86% of our budget. Just out of curiosity, I looked where we were at a year ago and it was about 84-point-something%. So we're even ahead of last year. God bless the taxpayers in Indian River County. They get the money in quickly. Moving to section 1 of the snapshot, you'll see the district's U.S. Treasury holdings. On December 31, our Treasury bills totaled $17,500,549. The last column to the right on this sheet shows the staggered maturity dates of these T-bills. There weren't nearly as many last month. They now run through November of this calendar year, and those T-bills listed were earning an average interest rate of 3.541%. Section 2 gives you the holdings of our money market account, the preferred deposit pool. And on December 31st, it held $3,238,772, and it was earning 3.61. And Section 3 shows the district's local operating accounts at Suncoast, totaling on December 31st, $2,051,286. Altogether, starting the second quarter, the district's investment and cash holdings were $22,790,607, and that's with 97% of those holdings in some form of allowed investment. Just as a point of comparison, on December 31st, 2024, our cash and investments totaled $20,546,942, about $2 million difference. Okay, let's take a look at the district's expenses by turning the page to the year-to-date expenses versus budget spreadsheet. Were all programs being funded equally throughout the fiscal year, all expenses would be at 25%, but of course they are not. So you'll see expenses ranging from 0%, such as our low-income pool payments. Those won't hit for another couple of months probably. And childcare resources, their vision and hearing screenings. There have been no reimbursements to them for that yet. You'll also see it as high as 62.8% for Healthy Starts Babies and Beyond Lactation Service Program. That's at 58.4%. And 58.4% for whole family life lab services. Those are two of the higher ones. Now that we have completed formally the first full quarter, she's nodding already. Jenny probably is already on this, but staff will now begin reviewing which programs are running hot, as I say, running significantly ahead of what their approved budget is, having discussions with them, making determinations about what, if anything, needs to happen on their part or our part. I did want to note on the spreadsheet, mental health court has now been removed from TCCH and falls under the agency mental health collaborative. And on the middle of the last page of the spreadsheet, you'll see the total for all program expenses at the end of the first quarter was $5,447,597. That represents 24.5% of the approved total program budget. The bottom half of the last page shows the district's administrative expenses. And based on some realignments in the monthly financial statements, I've consolidated a few line items, more specifically dues and subscriptions, travel and expense reimbursements, publications and other, into office supplies and service contracts. And if you really study the monthly financials, as I know you all do, you saw that we have just a little bit more to reorganize to bring that document into full alignment with what you see here. Fundamentally, we're very close. There's a couple of things we still need to tweak, but we're in good shape. And the numbers are right. It's a matter of syncing my report with their report. You see that the total administrative expenses through December totaled $411,712. That's 28.8% of the approved budget, and combined total programs and admin totaled $5,859,309, which is 24.8% of the budget. And then finally, as a point of comparison, at this point last fiscal year, our total expenses were $4,427,912 at 21.9%. Before I speak to an issue that was discussed at last week's Finance and Audit Committee meeting, I'll take any questions that you might have either on the cash and investment sheet or the year-to-date expenses. Not seeing any, okay. As I said, the Finance and Audit Committee met last week, where we spent much of the meeting in a review of the draft audit with Kip Jacoby. You will hear from him towards the end of our meeting today. Spoiler alert, it's pretty good report. However, as directed by the trustees at the December chairman's meeting, the committee did discuss the issue of requiring annual audits on some of the district's partner agencies, particularly those receiving the largest awards. Current language in the draft internal audit policy, which spawned this discussion, and a comment from someone in the audience at that chairman's meeting. That policy reads, the district shall conduct, and this is current policy, the district shall conduct internal audits of funding agencies on a rotating or risk-based schedule at least once every 2 years or more frequently, if determined necessary by the Director of Compliance or Board of Trustees based on risk, based on risk indicators such as funding level, prior findings, or compliance concerns. Staff has some concerns that were expressed about the fairness or perceived bias in setting a monetary threshold of support that would require an annual audit by the district. We had hoped to gain some insight on this matter from the two CPAs that are members of the Finance and Audit Committee. And as you might imagine, when you need them most, unfortunately, both CPAs could not attend that meeting. However, he's out there somewhere, I see him. However, our auditor, Mr. Jacoby, was in the room, was present, so we picked his brain a little bit on the topic. And Kip provided one or two suggestions that could appropriately allow us to modify procedures And the bottom line is, we didn't have time to reach a decision on that matter at that meeting, but we've scheduled another meeting with KIP. I think it's on the 26th of this month, where we're going to take this issue up again. I think there are some things that we're looking to get everybody on board, obviously, and be bringing that back to the Finance Committee, which at this moment isn't scheduled till early March. But that was something you asked us to run with, and we did, but we don't have any recommendation to make to you at this point in time. So with that, I would be happy to address any other concerns that the trustees might have. And hearing none, Madam Chair?
Any questions?
This is Paul. I've got just an observation. And then, as I mentioned yesterday, I've got some things I need to tend to, so I'll be excusing myself. But on the idea that somehow an organization that is receiving greater funds there's a bias against that organization resulting in the audit stipulated. We're doing the audit because of considering the topic. When I understood Mr. Alan Jones bringing it up, it has to do with the risk management decision and analysis. If you're receiving whatever threshold we're going to consider and above, we have a greater responsibility, the taxpayers, to make sure on a more frequent basis. So I would agree it's biased, but it's a bias with a methodology.
And I didn't say this, I didn't write it, and I wanted to read, so I got everything in. I appreciate almost all of you responded to what you thought that threshold might be, and I'll tell you, it ran the gamut from 750,000 to 2 million and more. So it did particularly help. I pretty much expected that's what it was going to be, but we'll be back on the hunt. We'll figure this out. You'll be hearing from the committee with its recommendation in the future.
And Michael, I apologize. I don't think you heard from me. And if I had sent you the email,
no.
I would have said 1 million. So that way you've got my input. I apologize.
Thank you, sir.
And thank you, everybody. And congratulations, Carrie and the rest. And have a great meeting. I need to excuse myself.
All right. Take care. Thank you.
Thank you.
And I think probably there was at least one person who said that the way we're doing it now is suitable. So, yeah. Okay, Executive Director Frank.
Thank you, Madam Chair. I'm just going to mention a couple items, and then I'm going to pass it to the staff for a couple updates. So one of the items is a follow-up item. So at our December 18th regular meeting, Trustee Westcott requested that the district send a letter to Dr. Rothman and Cleveland Clinic Indian River Hospital, recognizing their achievement in receiving a 5-star overall rating from Forbes and its top hospitals 2026 rankings. I did include that letter in my packet. That letter did go out. So I just wanted to close the loop on that. You know, on the heels of the mother-baby grand opening ceremony, which felt like it was just yesterday, but it was in December, Monday, we had the ribbon cutting or wall smashing for the new emergency room project at Cleveland Clinic Indian River. They're moving very swiftly with a lot of key projects, and that's very impressive. I just wanted to reiterate that. So now we're just going to do a couple staff updates. Dawn, could you maybe start, please?
Sure, thank you. This month, I distributed 2 audit reports to the trustees as they were finalized, one for the Learning Alliance and one for Child Care Resources. In addition, I also attached a modified and updated audit schedule. Shannon actually worked really hard to scale it down so it wasn't as busy as the ones that we used in the past. So hopefully you all find that helpful. I also worked on the development of new policies in line with our performance review recommendations. We have submitted a couple of those draft policies to legal counsel for review and guidance. And once we receive feedback from legal, we will revise with Frank's direction and finalize the policies to present to Finance and Audit Committee, and then ultimately to this board for review and approval. So if anyone has any questions, feel free to email or call me. Thank you.
Thank you, Don. And just two updates from Caitlin.
Okay. So the first update I have is actually about the annual survey. If you guys remember, I sent out the questions last month and feedback was great. The survey is now being launched, I believe, this week, so people might be receiving calls from them. And so we would hope to have the results. They're really quick with that turnaround. It's usually within a week or two of when they start fielding them. So we'll be receiving the results, which I'll disseminate to you, and then we're hoping to have them at the February chairman's meeting to come do a presentation on the results of the survey. So that's it about the survey. Are there any questions on that? No? Okay. All right. So second update is just another quick review of the dashboard that I've created. Here, let me make it full screen so it's easier to see. No, you're good. And so, yes, like we were talking about, we're now one quarter of the way through. So we have a little bit more consistent data. The first page is the encounters, and it's interesting now that we have some actual timeline data to see that first month was pretty high compared to how it seems to be going. And I think that kind of speaks to a lot of the agencies not necessarily knowing how many encounters they were going to have and maybe not knowing what they should include as encounters, which also probably factored into why a lot of them were running hot that first month and kind of surprised us all. And so as we've been working with the agencies to kind of clarify and make sure they're not, over counting encounters to the point where their budget is going to be blown in the first, quarter, I think the encounters are going to kind of level out from here on out. And so total, we've already seen those 63,508 encounters, which is pretty impressive for the first 3 months. It's going to be pretty considerable by the end of the year. And then it's going to be very interesting to see year over year how that's going to change and grow. And what also was really interesting was the almost 10,600 unique individuals. This past couple of years, we've only really been able to see the people in the portal, which was good information, but it only encompassed 5 agencies, I believe, were using it. And the portal averaged around 4,000 people. So clearly we can see that we're reaching more than double the amount that the actual portal was encompassing. So it's really good to see the actual number of people that we're helping beyond those 5 agencies. The 5 agencies are included in here that are still using the portal, so that it's encompassing all of it. And again, this page can be filtered. So if you want to just see certain categories, you can click on them and then it will automatically adjust all of the different boxes in the map and everything. So you can see, what zip codes, the different areas, all the different things are coming from. And this is on the website too, if anyone wants to ever go on their off time and look at it. And you can also filter by the program. So if you have a specific program that you might be interested in, it'll narrow all of it down for that too. The second page is the budget, which I know we kind of talked about a little bit already. And, I used a lot of the same stuff that Michael has on his report, what percent that we should be aiming for. If we were 1/12, we should be at 25%. So we are tracking a little bit over, but it all has evened out. But you can see what agencies are getting really close to that already. So you can sort by that. And same with this month over month, we're going to be able to see how their invoices might be fluctuating, if there's going to be changes. And then this little line says what the 1/12 would be. So you can see kind of a barometer for, are they over, are they under, month over month. So you can see what agency. And it will filter all of them too. So if you guys have any questions on that.
Caitlin, if I could just add to that before the board, because I know Alan certainly is going to have some questions. I'm sure he already did the quick math on this, is that This is the first time in all the years that we've existed that we actually have data, and I was excited to have a quarter because we can annualize a quarter, and that may not be an accurate annualization, but let's just take the numbers and say we do. That brings us to 254,000 encounters and 42,000 unique individuals, which is 25% of the population of our county. So those are some big numbers. And depending on what happens with the ACA, we'll see how the rest of the year goes. But for a quick annualization, it's great that we finally have some data, and I'm grateful that there's a ton of work that the team is doing to make these data available, and I'm grateful for that.
Thank you. All right.
Michael wants to talk, but we're not letting him.
There we go. You said ACA and it was in my mind. Is it likely going to be starting in February or beyond where those folks who have been hurt by that are going to have to look around and see if there's something that can assist them? We'll start spiking? I don't know if it'll spike, but seeing an increase in.
I'm uncertain on the timing of the resolution or what the final resolution is going to look like. I don't know that, we have enough data. We only have data through December. I think we'll have a better sense after January, February. So we need a couple more months.
Yeah, currently the portal, I didn't pull it up today, but the portal has been pretty much level for the last 3, 4, 5 months. It hasn't really been changing at all, but I would expect probably to see the portal numbers increasing as people are getting off of marketplace insurance.
Anybody else?
No other questions. That concludes my report. Thank you.
I'd like to point, if you, okay. Frank mentioned that Dr. Cooney sent a letter on our behalf to the hospital congratulating them, Forbes rating them 5 stars. Only 11 such hospitals in the entire state of Florida, which by itself is quite an extraordinary achievement. And so it kind of reinforces how important it's been for us to get a financially sound and well-operating hospital. I ran across a data point that I thought maybe you guys would be interested in. And that data point is that during the year of 2025 in the Scully Welsh Heart Center, which they do some really major stuff, as Dr. Mackett can surely attest. In 2025, speaking of coronary bypass surgeries, valve replacements, things like that, when you're inside the body dealing with the heart, they had 0 deaths. I think that's an achievement. You don't want any deaths, of course, and nobody goes into these surgeries expecting that outcome. But when you have 0, you just can't do better than that. And the Society of Thoracic Surgeons has recognized them as one of the top heart hospitals in the United States with a 3-star out of 3-star rating. So I think that kind of correlates with one illustration of how they earned that 5 stars from Forbes. So I just thought I'd throw that out for what it's worth.
Anything else? Any other questions, comments? Hey, Miranda Swanson, welcome. Glad you're here. For conversation around food access. Welcome.
Many thanks to the county's IT staff for helping get my presentation up, along with Kate. Kate's a master, so I appreciate it. My name is Miranda Swanson. I am the health officer for Indian River County. My master's degree is in public health. I've been in my position since 2007, and I know many of you. And so I really appreciate the opportunity to be able to come and speak on this important issue. With me today is Molly Steinwald, who is over our Community Health Improvement Program.
So in that position, she oversees both our community health assessment process as well as our community health improvement plan, both of which are very robust processes. When I saw the TC Palm article on Meals on Wheels and the associated cuts in November, I was very troubled by a recent decision by this board to cut and phase out funding to the Senior Resource Association for this program. Food access and food insecurity is a major concern to our residents and has cascading effects, especially for those with chronic disease. In that community health assessment process that I mentioned, we have approximately 100 partner agencies, and all of them agreed that food access is one of our priorities in our upcoming community health improvement plan, along with housing and along with health literacy. So we know that health includes both social and economic factors, and all of you are familiar with the phrase, maybe not, it might have been a few years, that where we live, work, and play determines our health. Issues of food insecurity are becoming more and more critical as people struggle to meet basic needs. Food banks and pantries, including the county pantry that we host at our Wabasso site, are straining with demands. We also have a senior congregate meal site at our Wabasso site for seniors in Wabasso that are very much transportation disadvantaged, very, very low income. And they come together for a meal at our Wabasso site. We're going to talk a little bit more about loneliness as we go on, and also the other impacts to the Meals on Wheels program. Meals on Wheels is part of a preventive health service. Having a nutritious meal strengthens primary care by ensuring the connection with nutrition and health. This connection makes medical care much more likely to be successful. For people in our vulnerable, under-resourced communities, when they visit the doctor and they're given a prescription, it's like that prescription is half full, because medical care is only a part of overall health. When your patients, and I know I have 2 physicians on this board, when your patients go home, they might not have a roof over their head, they might be struggling for food, they might not be able to make ends meet, and they might not even be able to pay for that prescription. It's very hard to be compliant with a treatment plan without nutritious food. For so many seniors, Meals on Wheels provides the only meal that they eat that day. It's a hot, nutritious meal 5 days a week, and also frozen meals for the weekend if they have the ability to heat it. I wanted to talk about the levels of prevention when we're talking about preventive care. You can see that nutrition plays a role in all 3 levels of prevention. And when you consider the morbidity and mortality from diseases such as diabetes, obesity, and cardiovascular disease, you can understand that. When we talk in public health about primary prevention, we talk about preventing disease before it starts. Secondary prevention to detect and treat disease in early stages before they progress. And unfortunately, many, many seniors, and all of us are in the senior, well, I'm in the senior category now, I'm 52. To manage existing disease to prevent further complications, reduce damage through the lifespan, and improve quality of life. That's where we can make an impact with Meals on Wheels. The top causes of death in Indian River County are cancer, heart disease, and stroke. Meals on Wheels is part, as I mentioned, of that secondary and tertiary prevention, and many seniors already suffer from chronic disease. It's essential to have good, nutritious food so things don't get worse. The need is great. An estimated 90% of $4.3 trillion annual cost of healthcare in the United States is spent on medical care for chronic diseases. And for many of these diseases, diet is a major risk factor. That's from the American Heart Association. Meals on Wheels provides a vital lifeline for the residents they serve. Not only is it the only meal they see that day, but for homebound seniors, it combats the loneliness as well as someone that checks in on them during the day. On many occasions, those volunteers have had to call 911. I've had the opportunity in my years in my position to be able to go out with the Meals on Wheels volunteers. The seniors we served, every single house, they were isolated. They were the only people in that house. And to watch their smiles when that volunteer came in and was able to connect with them and combat the loneliness that they likely experienced was something I won't forget. I thought this diagram, probably several of you have heard about the food as medicine concept, and there's been lots of studies that have been done on this issue. Food is at the intersection of healthcare and food and health. Many organizations, including Florida Health, the American Heart Association, Cleveland Clinic, the University of Florida, Treasure Coast Food Bank, all of them have initiatives in food as medicine. As part of addressing health, good nutrition is critical for those affected by chronic diseases such as diabetes, heart disease, obesity, and many other diseases. It's part of the treatment plan. And this is where Meals on Wheels is part of the patient's medical care. They're able to provide medically tailored meals. You can see this is their process up on the screen. And you can see that those nutrition risk assessments and nutrition reassessments are occurring with those clients when they're deciding about the meals that they are going to receive. It's through a registered dietitian. They provide 1/3 of daily nutritional value. They're low sodium, and there are special meals for dietary restrictions, including soft foods. Meals are also compatible with diabetes diets. Nutrition education is part of the Meals on Wheels program. I'm going to turn things over to Molly. She's going to talk to you about the data that we've gathered as part of our food insecurity work over the last several years. We care so much about this issue because this isn't, there's just so much concern in the public about food insecurity. We've been doing the work on this issue for several years. And so immediately when I saw the cuts and those impacts, it concerned us. So I'm going to turn things over to Molly.
Good afternoon, everyone. So Molly Steinwald, Community Health Improvement Manager at the Health Department. I have been facilitating a food security work group for the last 3 years through the Health Department. And the most recent data from food regarding food insecurity from Feeding America is showing that food insecurity went down for some time, but by 2021, not surprising like everything else, the rates started going up notably. So in the next several slides, I'm going to share with you additional data regarding food security in our county. And please keep in mind that the data that we are sharing is a couple of years old and just prior to some major funding cuts that we're seeing very, very recently. So also I wanted to point out that food insecurity, there are a lot of different words related to it. There's food access, food insecurity, food security, et cetera, all generally meaning the same thing. Generally, I try to use the word food security because that's where we want to get. Okay, so a number of years ago in 2022, the Health Department conducted a survey modeled after several national food security surveys for our county, and we received 527 responses, 4% of which were in Spanish, and we utilized a number of our partner agencies to get it out pretty extensively, and that survey was open for 6 months. What we did, I just want to give you a couple of county highlights. If everybody wants to see the entire survey, you're happy to. I'm happy to share with you. But from across the county, so this is looking countywide, 25% of respondent households cut or skipped meals at least once in the past month due to lack of money for purchasing food. 20% had actually skipped more than one meal in that past month when they were responding. 31% of respondents were not usually able to get the food they wanted, and this is 88% of the reason for that was because of the price of the food. Again, this is a 2022 survey, so keep that in mind. And also 54% reported that there were no fresh foods or market availability in their neighborhood. So what we did, we also bifurcated the data that we had collected to reveal trends community level wide versus just saying county level. So we did this by converting the data to percent responses per self-reported community. So people are able to say, I'm from Wawaso, I'm from Gifford, I'm from Central Vero, et cetera, et cetera. And that enabled us to standardize comparison across communities. So key highlights of what we found follow. And there's a lot more, but I just want to do a couple of key highlights here to get a sense. So consistently and not surprisingly, you have low-income communities showing the greatest need. For instance, in South County, Wabasso, Fellsmere, they contain the highest percentage of households responding that one or more adults had cut the size or skipped meals in the past month because of lack of money for food. Another highlight here. Oop, I jumped, I think. Did I jump? I sure did jump. Okay. Similarly, Fellsmere, Wabasso, South County, Gifford had the highest percentage of households responding that they used a food pantry for their source of food at least once a month. You'll also see on this slide that it also includes information about households using food pantries more than once a month within those communities as a food source. Likewise, I'm not used to your mouse. It's really nice, much nicer than mine. Likewise, Wabasso, Fellsmere, South County, and Gifford had the highest percentage of households responding, having more fruits and vegetables and lean proteins available at the food bank, the pantry, discount grocery program, or the delivery meal program would enable them to access and consume more of those healthy items. So as part of our food security efforts, we also reached out to Senior Resource Association that has been an active partner in our food security work group since its inception 3 years ago, as well as a very active partner in the efforts to improve health countywide. So we conducted the following analysis from their 2025 Meals on Wheels annual client survey. And what I'm going to do is simply read through highlights in the next several slides. So of those who reported their income, 76% were at or below $22,600 annual income. So that's at about 144% federal poverty level. 73% were widowed, divorced, or single, with the majority widowed. 96% received a meal delivery visit 5 days per week. 98% received a minimum of 5 meals per week, with 78% receiving 7 meals a week. 71% reported they ate only 2 meals per day on the days that they ate that home delivered meal. Well, 6%, so that's 3 people, and I know it's 3 people, but that's 3 people, reported that that was the only meal they had. 48% also reported that the home delivered meal they ate each day represents about 1/2 of the food that they ate for the day. 96% reported that the services that they received from the home delivered meals helped them to eat healthier food. 88% reported the services helped them to maintain a healthy weight. 86% reported that the services received from the home delivered meal helped them feel better. 80% reported that as a result of receiving home delivered meals, they had a better idea of where to get information about other services in our county. 88% reported that Meals on Wheels program has improved their quality of life at least 8 on a 1 out of 10 scale. Now, looking at their limitations, 92% reported using at least one and often multiple of the following mobility aids: a cane, crutches, or walker, a wheelchair or electric scooter, grab bars, shower chair, or shower bench, at least one. 84% reported that because of physical or mental health condition, they have difficulty preparing food, with some even reporting having difficulty using a microwave. 59% reported that because of a physical or mental health condition, they have difficulty getting in and out of a bed or chair. And 51% reported that because of a physical or mental health condition, they have difficulty getting around inside their home. 53% reported that because of a physical or mental health condition, they had difficulty getting around outside the home. And 20% reported that they feel that they are not doing enough social activities and would like to do more. This is critical here. 24% reported that during an average week, they were in touch by phone, internet, or email, or in person with a friend, neighbor, or relative who does not live with them 3 days or less a week, with multiple individuals reporting no days at all. That's pretty significant. That's a quarter. So we know that the individual risk factors for social isolation and loneliness include those with mental and physical challenges, like chronic disease conditions, psychiatric and depressive conditions, and long-term disability. This does not even include the effects of a diet that is not nutritious. Recall that 73% of the Meals on Wheels client respondents reported that they were widowed, divorced, or single, with the majority of them widowed. And the health impacts of social isolation and loneliness are well documented, including heart disease and stroke, type 2 diabetes, depression and anxiety, suicidality and self-harm, dementia, and early death. So I just want to mention the mental health statistics for our county and for seniors are alarming. These are just brief highlights here. In 2022, which is the most recent data, adults ages 65 and older, and my slides changed, but that's all right. Adults ages, so you'll have to listen to me. Adults ages 65 and older who have ever been told that they have a depressive disorder is 25% higher than the rate of the state. The rate of deaths from suicide continues to rise in our county, and in 2024, our rate of deaths from suicide was 40% higher than the state rate. It's been going up and up and up, and now we're at 40% higher. 9 adults aged 65 and older died from suicide in Indian River County in 2024, representing just over a quarter of the deaths by suicide in our county for that year. So, thank you.
So for these 300 clients, the lack of a nutritious meal each day, the lack of someone checking on them and combating loneliness, the lack of someone to call 911 because no one else is there. Meals on Wheels is critical. Meals on Wheels is part of preventive health. I urge you to reconsider your decision. At this point, I'd like to take any questions that you might have. We also have the references for what we talked about, if you'd like to see them.
Say something. I want to clarify because of the fact that I am, as a conflict of interest, whatever, I had no part of this. This is overwhelming to me. And I just want to say thank you.
You're welcome.
This is an amazing document, and thank you.
You're welcome.
And they did this, okay? Thank
This
you.
is public health. That's what we do. We talk about prevention and public health. And food is such an important part of combating disease. And when you don't have food, it's very, very hard to combat the disease that your doctor wants you to take care of. When they get a prescription, they don't have the ability to keep and maintain that nutritious diet without those nutritious meals. Thank you. I appreciate the opportunity to present.
When will the Department of Health have the more current data? I mean, that's 2022. It hasn't gotten better. I'm just kind of curious. When
So that was a special statewide, countywide survey that we did. That could be something that we choose to do as we are going into the community health improvement process and food access is a priority. That may be something that all of our partner agencies are interested in. We also collect some data as part of our food pantry up in Wabasso. and those needs are still critical. As long as I have time, I'll tell you what happened in Wabasso from our congregate meal site. And if you don't know about Wabasso, the average household income is $6,500. And that was from back, goodness, around the 2000 census, but I can tell you it hasn't changed much since then. They are a wonderful group of people, but there is not much money up there. When seniors signed up for the meals and we started working with SRA, everybody was seated like at the separate round tables in that center. Nobody was sitting together. And then probably by about the third meal, everybody came together to the center rectangular table and they were talking and they know each other. And it's so important to combat loneliness. It's so important about the nutritious meals. But as I said, there are cascading effects. And when you see our suicide data, you realize that loneliness is a tremendous issue. I know Karen, through the studies that she's done and the needs assessments, have found that over and over and over. But it's important, the work that the district does. It's important, the agencies that you fund. And prevention is important. It's not just a medical visit. There is a tremendous side to health that is outside of physician's office.
Where is your Wabasso site?
It's up off of, it's 8445 64th Avenue. So it's up off of 510.
Okay.
And there's a flashing traffic light. Come on up, we'll give you a tour. We're doing a lot up there with, we've got raised beds outside. We're growing a lot of fresh vegetables. Shining Light Garden brings food to us for our pantry. They're amazing. And we've got plans to be able to expand our work on planting some more fruit trees outside, establishing a walking trail, and doing more programming inside to teach about healthy cooking and expand our work there. We've got multiple partnerships. The Whole Family Health brings their bus out there once a month, once a week. Goodness, I'm nervous now.
Once a week.
Thank you, Molly.
Treasure Coast Food Bank has their mobile grocery program.
That's amazing.
Yep.
And that the bus comes. Yep. So come on up. We'll give you a tour. I know you have to come one by one, but we'll still give you a tour. But
Thank you for your presentation.
Thank
both
you.
of you. It's very informative,
thank you.
but just, this is my ignorance. How much of the Meals on Wheels budget does the health department contribute?
We don't contribute anything.
Okay.
So I don't have a
That
dog
kind of
in this
underscores
fight.
the importance of the hospital district.
Pardon me?
I think that underscores the importance of the hospital district. I just thought the public ought to know that.
Absolutely. It's important work that you do, Mr. Jones. And we don't give any funding to SRA. We partner with them on different initiatives. And it was honest when I said I saw the TC Palm article and I was so concerned. And I know you have tough decisions that you make, but I'm asking that you reconsider this one. And it's because I know what a problem food insecurity is, both for everybody out there, but also for our seniors. Thank
Thank you,
you.
Miranda. Molly.
Thank you for that.
Hey, Homer, Northern Health Association. Our semi-annual report.
Yes, hi.
Hello.
Miranda, that was an excellent presentation. Very informative, and not that you need my help because it was just so informative, but I just want to briefly just touch upon Maslow's hierarchy of needs. Basically says, what is the most important thing in life? What are the building blocks? And there are 5. You know what the first one is? It's food. If you don't have food, it's more than shelter, more than love, connectedness, it's food. So thank you. Okay, so with that being said, hello, thank you for having me. I'm not alone today. I'm here with my two colleagues, Angela Gazinski and Heather Roberts. They're our Chief Clinical Officer and our Chief Operating Officer. They also did a wonderful job on this report. I cannot take, I got to just take a smidge of credit for it, but they're the driving force behind this. You know, when it comes to reports and reporting on things like this, reports just aren't that exciting, are they? But I have to say, of all the reports that I've given, this one to me is one of the most exciting reports because it just so beautifully highlights initiatives that we started many years ago, 3-4 years ago, and it's all kind of comes to fruition in this report. So I'm just going to touch upon some things, and if you have some questions, we can get to that. Several years ago, you will probably recall that we were knee-deep in a program called Erica's Lighthouse. Wildly successful program. We saw hundreds of students, sometimes in a day, 50, 60, 80 students. And due to the days we live in, the program was sunsetted. So what did we do? And this is something that we really, I think we all do very well, but in particular, the Mental Health Association, we had to pivot. We had to look into the future and we had to address this need. How are we going to help these kids? How are we going to see these kids? Can't get in the schools. So we thought collectively that we would seed a few creative programs and we would open the PAC Center with your help. So thank you very much for that. But also we were going to start this skill building program. We weren't sure exactly where it was going. We had hopes. We had hopes to be back in the schools. We just knew it was going to work. There was a need and off we went. So coming back to the report, 2 key learnings from the past 6 months. Well, we are back in the schools. Phenomenal. We're in Fellsmere and we're getting into Citrus. And also because it is coming full circle, we actually presented the Erica's Lighthouse program to the charter. So it was expected, but it was unexpected in a way. We knew that this was going to really take off, and it is. So that was sort of the unexpectedness of it, because I think you could probably see us in all the schools in very short order. We just don't have enough staff right now, but that's what we're learning. It's reinforcing our strategy to meet kids where they're at. So they weren't in the schools. We provided a space. They came to us, and now we're back in the schools. And really big credit due to the Indian River School District and having us back. So it's just really phenomenal to be back. The other unexpected kind of thing that's happening is the strain. Well, I call it strain. It's a good problem to have. What I mean by that is mental health court. Okay, so TCCH was doing a lot of the work with mental health court. I think we've got all that ironed out, which is really great. There's a little bit of an issue. It's not too bad. This is something called bridge appointments. When people are leaving the jail, a lot of times they don't have enough medicine to get them through to their primary care physician or community, healthcare facility or whatever. So that kind of got dropped. It didn't get dropped because we took it up, but it is putting some strain on us. So we're going to have to expand that in a little bit. We'll get to that, but that is kind of an issue that I see happening. What didn't work? Well, it worked and it didn't work, right? So, these programs are working, they're taking off, but we really don't have the staff to fully do everything we want to. But that, once again, that's kind of a good problem to have. Expansion opportunities emerge faster than what we could really sustain. But then again, it's, like I said, it's a good problem. Another thing that's happening is, let me see. Oh, okay. So going back to some of the creative programs that we seeded, we didn't know what was going to work. We knew the skill building was going to take off, but we wanted to do some creative things too. So we partnered with other nonprofits in town. One of them is Vero Beach Rowing, and we met with their CEO, and then we met with Phil Barnes as well, and we came up with this idea of what can we do for kids? We can't see them in schools, but how can we get to a kid who needs help, and that we can kind of get them some physical health and some mental health all at the same time. So what we did was we had the Wellness on the Water program. So Phil was able to identify kids at Youth Guidance. He brought them over to Vero Beach Rowing. They provided the rowing and the classes for all that. And then we had a therapist go in there and do team building and skill building, essentially what we're doing in the four walls, but we're doing it out on the water. It's really gone amazingly. But once again, it's gone so well, they want to expand it. So we'd love to be able to do that, but it's going to require some funding in some way. We're going to make it happen regardless, but we're just seeing the potential for more there. As a matter of fact, we've been working with our sailing, the Vero Beach Community
Youth sailing.
Youth sailing. Yes, sorry. So youth sailing. So we're essentially doing the same thing there, but we just don't have the bandwidth to kind of get that moving. So it's going to work. It's just a little clunky right now. As far as emerging issues, what we're seeing primarily right now are issues in the marketplace insurance. We've kind of talked about that a little bit. Plans are changing. They're getting expensive. What happens when, someone who really can't afford the plan in the first place gets a hike? Well, they either can't have it or they have to go with a lesser plan. It's delaying care. It's complicating care. We're not sure how this is going to go, but it's an issue and we're seeing it. I think a lot of people would say, well, this is just kind of your physical health, but this is very much mental health, behavioral health as well. So that's an issue. Kind of along the same lines as the concierge medicine. See a lot of doctors. My own doctor, miss him, haven't seen him in 2 years. He, left Cleveland Clinic. So that's good for him, bad for me. Our hospital is great, but it does, once again, it's a delay of service, right? It's not just a delay in service, it's the medication management piece is really big. So that's an issue. It's just a disruption. And when we lose a physician, we just don't lose the physician, but we lose the trusted referral also. I mean, yes, they're going to concierge, but it just changes. It makes it clunkier. It just complicates it. Lastly, with emerging issue, really, I look at it as more of it's an opportunity, really, and we're seeing the need for more family-centered intervention. So take the skill building, for example. It's a wonderful program, helps kids with executive functioning, organizing, thinking, really translates into them not having psychological and academic problems in the future, right? Our purpose here is to stop the problem before it gets going. So that's great. But it's more than just the child. It's the whole family. It's the parents. Where are these problems coming from a lot of times, right? Sometimes it's the family unit or the dysfunction in the unit. So we've added a parent support group also to kind of help the parents of the kids who need some bolstering of their executive functioning. So that's that. And as far as what's going to be different in the next 5 years, well, it pains me to say that in 2 years, in July 2028, we're going to have to move. We're being displaced, very unfortunately. Kite Realty owned our buildings, and last year, it was just kind of very surprisingly came up that the buildings were sold. Got a phone call one day, the buildings are sold. So great for Whole Family Health, who purchased the buildings. Good for them, bad for us because we're going to have to move. So we have a lot of work to do in 5 years. We've contracted with Carter Consulting and Lenora Ritchie, who's been wonderful. So we also have formed our expansion task force. So we have a small task force. We're having a board retreat soon, and we're working the problem and coming up with solutions, but we're going to need capital. So once we land on something exactly, we know what we want, and we'll probably be having more discussions in the near future. But that's all I have for you. There are things in the news with SAMHSA grants and things like that. We could probably talk about it until the cows come home, but it's just kind of more in the same, the sort of shock and retreat tactic of this day and age. We're not sure where it's going to go. Is it a problem? Yes. How is it going to shake out? We don't know. Probably some budget cuts, not the whole thing. I know for our staff, we get questions all the time. Makes people nervous, makes them scared, makes agencies like ours but more risk adverse. Gosh, we'd like to do this, but should we? What happened? What if? So it's just challenging times, but like we did a few years ago and pivoted with the school issue, we'll handle it, and we'll work as a team, and we'll get through it together. So thank you. Any questions? I know that's a lot. Thanks, y'all. Appreciate it.
Thank you.
All right.
Thank you, Dr. Coleman.
Unfinished business. All right, new business. HIP, our annual audit. Stunning, exciting.
Very exciting.
It is exciting because there's nothing bad, right?
It's all
Like-
good. Yeah. Well, good evening, everyone. It's my honor to be back before you again, presenting your annual report. I believe you have the document, so there's a lot in there. As Michael said, we spent at least an hour with the Finance
Full
and Audit
meeting.
Committee. Yeah, it was a full meeting. Great meeting. A lot of good discussion. But I will go through and highlight some things. If you have questions wherever I'm at, sing out. If you want to delve in more detail, we can do that. But otherwise, I'm just going to go through and dig in and start highlighting some things. As you flip open the report and go past the first few pages, you come to the independent auditor's report, clean, unmodified report. So it's the highest level of audit report you can attach to your financial statements. The next section we come into on pages 4 through 20 is referred to as the management's discussion and analysis, MD&A. That is where you as managers of your business have an opportunity to comment about the financial results and really more than that, the operational results. There's an awful lot of data in here and information about operations. But I'm going to kind of set the stage on page 4 with table 1. And this table drives your revenue source. It drives everything that you can do as a special taxing district. As you can see in the 24-25 operating period, For taxing purposes, the whole county had just under 29.4 billion of tax base. That's up from 26.6 billion last year, and just 4 years earlier, it was only 19 billion. So in 4 years, it grew $10 billion, which is amazing. Down within the table, you'll see that of the just over $14 of millage, you represented 76.5 cents of millage on the taxing, or about 5.43%. That is up from the last couple of years prior to that, about 3.7%. So that information's there. That volume rate presentation, in essence, drives the revenues that you generated over, as you'll see, 21 million during this fiscal period. The next page gets into 5 years of overview as to how you as trustees set your millage rates and some of the reasons you set them where you set them. So I'll invite you to review that and read that. On page 6, you start to get into some of the operational focus. You had 3 significant program impacts that you were working on this past year. As you I'm sure will remember, working on the maternity care access issues that were for the community. Looking to expand through TCCH, their primary dental and behavioral health care programs. And then thirdly, the mental health and substance use services. The next several pages comment further on quite a number of initiatives that you had running during the year, some continuing from prior years. So I'll invite you to read that. Turning to page 11, we now get into my bailiwick, which are the financial dollars, the results for the year. And it gives you some overall highlights in terms of your net position, which is up to 12.2 million, up about 15% over the prior year. Cash investments did go down as you invested in capital, but also operations. So that provides a variety of information. But if I can picture per 1,000 words, page 13, tables 3 and 4, really provide you an overview of your financial information on a capsulized basis. Table 3 is your balance sheet, if you will, presenting your total assets of $14,560,000, which is up from $12,287,000. The first line, current assets, is substantially cash and investments that you held at the end of the year. Capital assets is up quite a bit. You may remember, of course, during the year, you acquired the 10th Street property for a little over $4 million. So that rounds out your asset composition. On the liability side, it's important to note that as a special taxing district, you have no debt financing. You have no need for that. You generate the resources that you need through the tax base. The total liabilities, though, did go up about 750,000 or so, and that relates to the remaining grant that you had, the capital grant for TCCH. You provided a $1 million grant, 750,000 of which is going to be paid over the next few years. So that's been set up as a liability obligation as a firm commitment. The net of that is the equity of this taxing district, referred to in governmental parlance as net position. And that stood at $12,191,530 at the end of the year compared to $10,593,000. The composition of that in terms of the net investment of capital assets, again, that's up quite a bit for the 10th Street property acquisition. Unrestricted is down, still a healthy 6.9 million, down from the 9,356,000. That in essence is the net increase of about $1.6 million that you had during the year, minus the utilization of reserves to acquire the 10th Street property. Table 4 presents your revenues and expenses. Taxing revenues, 21,181,000, up from 12,008,000 in the prior year. Operating expenses totaling 20,233,000, 18.8 million of which relates to your program mission as a taxing district, the indigent care and program funding. That's up from 16 million. In total, it's up from the 17 million in the prior year. On the non-operating side, you've generated about the same amount of investment income on the earnings or the cash investments that you have. Last year, you did have a $3.8 million gain proceeds out of the sale of the property for VNA. So that was kind of a one-time unusual event, one time ever, I think, in the district's history. So overall, you generated a net positive increase in your net position, net earnings, if you will, of $1,597,000. The other big picture that I'd like to turn to for you is on page 15, table 5. And that is a large table overview of the various different agencies that you fund in comparison between the 2 years. You'll remember the 18.8 million I just referenced, up from the 16 million. You can look down through the agencies. And again, focusing on the very top line, the reason for the increase in TCCH is the $1 million capital grant that was kind of a special one-time event. But that gives you and the readers, of course, the overview of the breadth of agencies and the dollars that you invest in the community. Now let's go to table 6 on page 16. Just stopping briefly about middle of the page. Again, 10th Street property invested $4,090,000, which was not there in the prior year. No debt financing, as we mentioned. And then on page 17, a comparison to your budget, your estimates for the year. You had budgeted gross net revenues, if I can say it that way, of 21,009,000, and you generated 22.2 million, or a favorable variance of 380,000. I say gross net, the typical expenses that come from the county that you reimburse for the property appraiser and tax collector, they're grossed up, and so they're presented down to the expenses for budgetary purposes. And so there you can see you also had a favorable variance from budget, 20,683,000 in expenses, a little bit less than the 20.9 million that you had budgeted. So overall, you had a $677,000 favorable variance in your overall operating results. The last part of the MD&A that begins on page 18 focuses on what's coming up for the future. It's a forward-looking section of the MD&A so that you can bring the reader attention to the things that you're working on and where you see the upcoming year or years heading. So with that, we could move into the basic financial statements and footnotes. I'll spare you for that because it'd be a restatement of what I just went through, but it does provide more detail, a lot more description in the footnotes, accounting policies and procedures that you have to support the financial statements, appropriate, consistent policies for special taxing districts. So I invite you to read that. And again, of course, if you have any questions, be happy to answer. And then the last part of the annual audit report includes a few special letters that were required as part of governmental auditing standards and reporting for the state of Florida. Page 33 and 34 is the report on internal control and compliance. Again, a clean, unmodified report, no special attention matters that have been included in the letter. The management letter on pages 35, 36, and 37, that also is a prescribed letter from the Florida Auditor General's office, and it asks us to comment on various things. Some of them rather straightforward. The section on financial condition and management, I think, is a very important section for taxing districts. And of course, we note no issues there. Financial condition side, we spent some time, a little bit of time talking about that at the audit committee meeting. They try to have you benchmark your financial operations and results with other similar entities within the state of Florida. And so If you're a county, you have 67 counties of marking data to look at. If you're a municipality, I don't know how many hundred. Special taxing districts of a hospital nature, there's only 3 others. So it's a little bit more challenging, and because of that, the overall results come back inconclusive based on the stipulated assessment structure that the Auditor General puts out. Again, happy to share that report. I think I owe that to you, Frank. But I think you can glean from the report that you have a strong financial condition. So with that, I will add many thanks, of course, to you all for the opportunity to serve you in this manner, but also to Frank and staff for assistance and support getting through the audit process. With that, any questions?
Very thorough.
Okay.
Thank you.
All
Do
right.
we need to move adoption, acceptance, approval of the audit? I'm not sure what the language is, but I would do that.
That was perfect.
Accept the as presented. For a second?
I did.
Any discussion? All in favor?
Aye.
Oh, motion carries.
All right.
Yep, thank
Thank
you. It's
you.
always easy to work with you.
Oh, well. thanks.
We appreciated you sticking around the other day and giving us more time on the 26th. I mean,
Happy to do that.
fun stuff.
Love talking auditing.
It's been doing this for 20 some odd years because I remember your hair color and my hair color was a lot different.
You're not supposed to notice that, Karen. So it's interesting, side comment. I had double duty today in terms of another client in Palm Beach. I had their annual shareholders meeting. So double duty in terms of I never wear a tie and a coat anymore, but wore both today for both you and them. But that was my first audit moving to Florida in '86. And so I've been doing that one for 4 years.
Wow.
So anyway, I appreciate the opportunity and do enjoy it.
Good.
And
Yeah.
is there anything that you would want to say at this point about the indigent UAP?
Oh, yeah, well, the draft has been
Yeah, I mean,
submitted. It's really a pretty clean report. There are a couple
I
things.
thought so too. There
always-
was, the one that stands out was the New Horizons. Just
Yes,
You define UAP
Yeah.
for the minutes.
AUP.
Everyone knows.
AUP.
agreed upon
The-
procedures report. You may remember every year, in addition to the standard
Right.
audit, we go through and select a number of transactions in your indigent support program. For this year, it's 5 agencies that have been on, in essence, the pay per service, the census-based type programming. That draft's been presented. We're actually gonna, at the 26th meeting, I think we'll review that, but I think I'm on the agenda for your chairman's meeting in February to go over that with you all. You know, there's always something that we find. We have to justify our
Well, the fact
existence
that
a little
you
bit.
find them shows you're really going through it. I mean, staff knocks himself out as well. And when you see anything at all, and there were a handful, there's always 1 or 2.
Mhm.
But there were a couple this time. But it was, what was the total of them all? 17,000 maybe out of, all of it?
Dollar wise, very similar.
yeah.
It's interesting in the agency, and we're a little bit ahead of what we'll present, but I think in the past, we've almost with every agency, we've found 1, 2, 3 comments or issues or exceptions, if you will. We had a number that had 0, but one that had 9. But they were all the same issues. So, you know, again, I think very good results. And if you go back that 15 or 20 years, there were a lot of exceptions and a lot of dollars where you were actually going back and recovering funds, or in a couple instances, actually issuing more funds. So we found some that went both ways during those years, but it's been very clean historically, recent historically.
in some ways, this is almost as important as the audit. I mean, we've got the performance review that we always think about, but this does a deep dive. You know, it's additional data that really shows that we're serving the taxpayers well,
Mhm.
not wasting the dollars.
And if I may, just as another preamble for the discussion to come up, one of the things we talked about just in trying to decide and give you guidance, where do you go with your internal audit type program? I invite you to go through, and Karen, you'll know this very well. Single audit parameters and programs that come out of the state of Florida and the federal government since 1984 might be a model to follow in terms of how you might decide how you apply your own procedures. So if you want to do some more fun reading about auditing.
I'll wait for you to tell.
Thank you, Kip.
Right,
so
thank
much.
you.
Thanks. Any other business? Your public comment? Okay. Meeting is adjourned.
Thank you.
Thank you.
Yes, sir.